The first interesting case I can think about for a burn patient was a woman who was at the church feeding homeless, and a man lit himself on fire and attacked her while in the kitchen. She fortunately survived the incident, but was severely badly burned. About 40% of her body surface area was burned. Just seeing that acute aspect of her and how calm she was as a woman at that time, going through such a traumatic experience, and being in that setting to acutely manage her the best that we could with appropriate IV fluid hydration, elective intubation basically, since we saw soot in her mouth, and wanted to make sure that we would have an intact airway when necessary. And then shipping her off ultimately to the burn center. I can remember another injury, unfortunately, where the man did expire from it. He was working with power lines and was exposed to a high voltage of electricity, and it actually flew him from a ladder that he was on into the side of a building. So you have not only the electrical injury, but a trauma as well to deal with. And the exit wounds through his work boots, they just basically the electrical activity blasted the work boots away. And he came in cardiac arrest, and we weren't able to revive him. And then probably the third interesting case I can think of was only about a week and a half ago, where a man was found in a house, in a house fire, and was thought to be in cardiac arrest, but that was kind of questionable whether he came in. But he came into the emergency department by EMS awake and alert, but had an altered mental status. He really wasn't responding well to us. We drew some labs and found that he had an elevated carboxyhemoglobin level indicative of carbon monoxide exposure, which was significantly elevated, and we were also thinking potential for cyanide toxicity since this was a house fire. So he had already been receiving high-flow oxygen as much as we could through a non-rebreather mask, but we did end up intubating him and providing him with good oxygen support for the carbon monoxide exposure, as well as hydroxycobalamin for potential cyanide. And that was the first time I had actually mixed hydroxycobalamin, which was interesting for from my standpoint, and the nurses that I worked with who had never dealt with that medication before. So in those certain instances, he actually wasn't physically burned, but we thought that he had thermal injury to his airway, hence why we intubated him, and just for the critical severity of what he was going through. It was a very good learning opportunity, and hopefully this man doesn't have any long-term effects from the carbon monoxide or cyanide exposures.